Thank you for joining us today for our Survivorship special topic in September. My name is Julie Lanford, and I am the Community Engagement Director at Cancer Services. We are a cancer support nonprofit located in Winston-Salem, North Carolina. And each month, Cancer Services posts a special topic expert video in a variety of different topics related to cancer survivorship and caregiving. These videos are posted on Cancer Services website as well as our YouTube channel, and we also share the audio on our podcast called the Triad Cancer Connection. So all survivors and caregivers are invited to join us for our special topic discussion group, which is held on the fourth Tuesday of each month at 7 p.m. So that's September 26th for this month, where we will ask you to view this video ahead of time and then talk with other survivors and our survivorship team at Cancer Services in regards to what questions you have or where you think your next steps are going to be. So we do ask that you register if you plan to attend that event. You can go to cancerservicesonline.org/register to sign up for that discussion group. So our topic this month is navigating health insurance options, and we are lucky to have an expert on this topic. Sarah Jolly is a Certified Marketplace Navigator with the North Carolina Navigator Consortium, and she works for Legal Aid in Forsyth County. So, hey, Sarah, thanks for joining us today.
Hello, thanks for having me.
So we decided to do this topic because, of course, health insurance is important for everyone, but especially for people who've gone through cancer treatment or are currently in cancer treatment and have more medical appointments, more medications than the average person. Of course, during treatment, it's expensive. We kind of all are aware of that. It's one of the most expensive health diagnoses that you might face. But also, even after cancer treatment is over, survivors have a lot of follow-up appointments. They have regular health monitoring appointments that are essential for good health, but realistically also affect your budget. So health insurance is really important from the standpoint of making sure you have access. So Sarah's going to help us kind of figure out, what you might do if you're not so sure about your health insurance coverage or maybe what you might need. So, Sarah, let's get started just with the basics. Can you give us an overview of how people typically get health insurance coverage in the U.S.?
So typically to get health insurance coverage in the U.S., you can either qualify for Medicaid, which is a state-based program for low-income individuals. You can qualify for Medicare if you're over 65. And then if you fall in the middle, you can either qualify for a job-based plan, so your employee coverage that you get, and typically if you're a full-time employee, or you can get a plan through the Affordable Care Act, which is the federal marketplace for health insurance.
Gotcha. So do you know off the top of your head, what kind of income level does it take to qualify for Medicaid?
So for Medicaid, it is less than 100% of the federal poverty level. It's typically extremely low income for childless adults.
Okay, gotcha. Because I know we do financial assistance at Cancer Services. Our financial assistance in terms of helping people with medications goes up to 200% poverty. So I guess we have a lot of clients who qualify for our financial assistance who would not qualify for Medicaid.
So you would qualify for financial assistance in premiums up to 400% of the federal poverty level for a marketplace plan.
Gotcha. So
you can
Medicaid is one level, but then on the marketplace, even if you're up to 400% poverty, you can still get subsidies.
Some help for your monthly costs.
Gotcha. So for those who qualify for Medicare, that's based on age, right?
Yeah. So you'd be 65. I unfortunately can't assist with Medicare, but I do recommend people call the SHIIP hotline, the North Carolina SHIIP hotline, the Seniors Health Insurance Information Program. That phone number would be 855-408-1212, and they can definitely help with all of the Medicare type questions that you guys might be having.
Okay, perfect. So we'll put that in the show notes. So if you're watching and you're a Medicare covered person, We probably won't be talking much about how to choose a plan. And I know for a lot of people, the supplement plans are confusing. And so we do recommend you reach out to the SHIIP program, which was what does it stand for again?
The
Senior
Seniors Health
Health
Insurance Information Program.
Information Program. And there's that 800 number that Sarah shared is for the whole state.
And they
So
can explain all of the plans and help guide you in Medicare, because that's also difficult.
the whole nother, yeah. Okay, so for those who are basically under 65 and don't qualify for Medicaid, so let's say their income is above 100% of the federal poverty guideline, there's a possibility they qualify for subsidies if they don't have employer sponsored. So really their option is to get on the marketplace and find a plan. Is that right?
Yes. And with the marketplace, so like a tax household of one, who makes $13,000 or $13,500 a year, qualifies for extremely low cost premiums. So our big selling point, I guess, when talking about the marketplace is that 4 out of 5 North Carolinians pay less than $10 a month for a marketplace covered plan. So almost everybody qualifies for a marketplace plan with tax subsidies to help you pay for the cost of your coverage.
Gotcha. Okay. And those plans won't be available like for browsing until
We
when do
call it
those
window
get announced?
shopping
Window
until
shopping.
I'd probably say like the second week of October is when those plans would be available to view, and you'd be able to view them based on your zip code, because every county will have different plans.
Okay. And so kind of if people are marking their calendars, the marketplace opens for you to sign up November 1st.
Yes, on November 1st for coverage to start on January 1st.
Okay. So they need to mark your calendar for second week in October to log on and see what your options are. Mark your calendar for like November 1st to go ahead and try to figure out and sign up for what it is that you need. And then the coverage would actually start January 1st.
Yes. And then
Okay.
if you put in an application after December 15th, your coverage would start February 1st.
Okay. So definitely sign up before December 15th.
Yeah, the first 45 days of open enrollment.
Okay. All right. So I also, know there's been some discussion about our state expanding Medicaid, which would maybe make the eligibility higher than 100%. But
yes.
I think they decided they want to, but we're sort of waiting on our state legislators to figure out what that is. Can you help us understand where we currently are?
Yeah, so Medicaid has technically expanded in North Carolina, but we can't implement it until we have a budget. So right now we're leaning towards probably a January 1st is when we'll know who will qualify for this new Medicaid in North Carolina. And we've kind of been given the idea that it would be people at about 138% of the federal poverty level. So if you're making more than like that $13,590 that would qualify you for a marketplace plan, you would now qualify for a Medicaid, which is a free health insurance option for you.
Okay. But we don't suggest that you wait to find that out, right?
Yes, don't wait. If you put in a marketplace application, we can help you terminate your marketplace coverage and switch to your Medicaid coverage if you're eligible. That's something that we can assist with.
Okay. So bottom line, if you think you might be eligible for Medicaid, you should go for it. And if you think you might be eligible for the expanded Medicaid, which we're not going to know about until January, you need to go ahead and get yourself a marketplace plan. And if, when we find out who qualifies and who's eligible, you can always change that later, because it counts as like there's certain types of events you're allowed to change your health insurance
so
coverage.
those are special enrollment periods, and those are typically like moving, having children, like a loss of coverage. So those are ways that you can qualify for a special enrollment period for the marketplace throughout the year. But without one of those, you wouldn't be able to enroll unless you're between 100% and 150% of the federal poverty level, in which you could enroll at any point through the year.
Okay. Yeah, if your income changes or your job changes or
there's
whatever.
plenty of reasons that could get you a special enrollment period. They're almost impossible to name them all.
Okay.
But all of our navigators are experts in that and can help get those approved through the marketplace.
Okay.
If you think you qualify for one.
Like, you've helped people kind of look through options on the marketplace. So as they think about, getting prepared for the second week in October when the plans are going to be announced, and they start figuring out, okay, which plan's going to best meet my needs, what kinds of things do you guide people about when it comes to how to choose when you have these choices on the marketplace? Like, how do you choose a plan that's right for you?
So something that I always direct people first is an out-of-pocket maximum, so the most that they would pay for in a year, as well as their deductible, which would be how much they would have to pay before their coverage starts, or before the insurance starts paying for that. And then besides that, I look at if you see a lot of specialists, like how much do specialist copays cost? How much do your prescription medications cost? Those are things that I kind of guide people to. So people might be more willing to have a higher out-of-pocket maximum or a higher premium if their copays for things like specialists or prescriptions are lower, because that would lower it. You always have to think about, is it going to cost me more overall through the year or less monthly? So you gotta kind of play with it a little bit, see what's going to work best for one person. And of course, a plan that works for someone might not work for another person in a similar situation. Every person's medical needs are so much different. And so you just have to think about what costs can you cover most or less? It's a toss up. So I look at the deductible and out-of-pocket maximum and the copays for things like specialists and prescription medications. Because of course, preventative care things are covered 100%. So you got to think about what will cost out of pocket.
Right. And most of our clients who face cancer are going to have specialist visits, and they're not necessarily considered preventive, although they may also be doing preventive visits. They're unlikely to be the clients who only go for preventive visits.
I completely.
They're going to be people.
Yeah. So you need to look at what costs outside of and the marketplace does have an interesting tool where you can kind of guesstimate how much your medical costs are for the year, and it can kind of show you what plans would be better based on your expected medical costs. Of course, it's always an estimate, but they do have some tools that can help estimate what your out-of-pocket costs would be with your medical needs.
Okay, so it would be helpful if people kind of had a sense for how much money they were currently spending, or for the last year.
Yeah. It can be helpful, but it's not always necessary in choosing a plan. So it's it could be helpful, but not required in picking a plan.
How much detail are people given? As you're browsing, whatever, window shopping?
You have access to the full summary of benefits.
Okay.
And so when you're initially shopping online, it's kind of scattered around. This is why I would recommend using a navigator. They can find the summary of benefits on the website. They can go in and make sure all your doctors are covered, all of your prescription medications are covered. We know how to go into the formulary. We know how to we will do the legwork of making sure your prescriptions and doctors and facilities, hospitals are covered before we let you choose a plan that's not going to cover your needs.
That's so helpful, because I've heard there are some plans that only work with certain hospital systems. Yes. Is that true?
Yes.
Okay. So
particularly for Forsyth County, you're typically going to have to decide if you're going to do Wake Forest Baptist or Novant Health. And for 2023, this coverage year, there was no insurance companies that covered both.
Oh, wow. Okay.
So
So if you go to both, I mean, most people facing cancer, they've got their treatment center is one or the other. But sometimes they go to the other one for PCP or who knows. Can you actually go to both on those plans, or it's like if you go outside
if it's out
network, you just
network,
try
it'll
to
likely
pay?
cost more than
Okay.
Except for urgent cares or the emergency room.
Okay.
So typically if you're facing out-of-network providers with insurance plans, we recommend switching doctors if you can so that they remain in network.
Okay. That's really important. I mean,
Yeah.
to make sure you get the cover. If you like your doctor and you want to keep them,
You
if you
have
want an
to,
excuse to get a new doctor, this could be a good reason.
yeah. So, so that was a problem that we faced in Forsyth County this year, and I've understood that it's been a problem in the past. Hopefully, when the plans come out in October, there will be something that covers both Novant and Wake Forest Baptist, since they are our two largest healthcare providers in the area. Fingers
Gotcha.
crossed.
So yeah, it would be good. People can browse the plans, but before they actually click the button, it would be wise for them to speak to a navigator, to have the navigator just double check on their preferred doctors, their medications, to make sure that the plan that they think they want will actually cover. Because gosh, that would be like a
And a
big problem
navigator
in
can work
January.
out any other questions that they might be having about their insurance. And they can also help with like insurance grievances as well if they're having any difficulties
Okay.
with the marketplace or with their insurance companies.
Gotcha. So how do they touch base? I mean, I know you are here in Forsyth County, and
Yes.
work through legal aid, but I believe you said you can call and actually work with, like, any navigator across the state can help anyone regardless of county. Is that right?
Yes. So we
Okay.
have I think 25 or 30 navigators with legal aid across the state, but but we do provide access to help in every county of North Carolina, be it on Zoom or in person or over the phone. And the best way to make an appointment would be by calling our hotline, which is at 855-733-3711. And they can help get you set up with a navigator that is available when you are. And in your area, if you'd prefer, and they can set up in person or on the phone, or you could visit our website at ncnavigator.net and visit our Get Help tab.
Okay. And can they schedule on the?
Yes, at our Get
Okay.
Help tab, they can schedule their own appointments.
Okay. Well, that's super helpful. Let's see. I think we covered kind of the big picture stuff. Is there anything else I'm missing you think people need to know?
Um, I would like to say that we do offer language assistance for appointments. So, like, we have Spanish speaking navigators, but we also have access to a language line so that we can assist people in
Okay.
any way we can. And I guess that's all that I guess I've covered like the big picture idea of health insurance and
Yeah.
where to start for getting it.
So for the language, I'm just thinking from our staff perspective, or if somebody's like helping. I know I have friends who help with like refugees who are moving to town. Can like can we go on the website and request language services and like pick the appointment time, and then is
Um,
that how the
you
person
can
connects?
specify a language need when you make the appointment. So it gives you a
Okay,
language option.
gotcha. Okay. That's really helpful. Well, okay. I think, at least for now, we've covered what we need to, and people know who to call and where to go if they have additional questions. So thank you so much for all this
Of
super
course.
helpful information. And we will make sure to put links in the show notes and in the comment section so that people know how they can. And do you all work year round?
Yes, so we
Okay.
are available year round, and We do a lot of community outreach, so you might have seen me around at events in town. We do a lot of community education about health insurance as well, so we can always be available for presentations about how to use your health coverage once you have it.
Awesome. Yeah, we should do that
Questions.
another month.
We should.
So yeah, if anybody's watching this and it's past the open enrollment time, but you do need advice, they're still available year round to kind of get you on the right page. Okay, well,
I
awesome.
guess
Thank you so
another
much,
important
Sarah.
comment might be that all of our services are completely free, of course, as
Oh
well.
yeah,
If that hasn't
that's
mentioned,
great.
and it's completely free and unbiased. So some people think instantly that we are insurance brokers and make money off of signing you guys up for health insurance, but we truly just want to make sure everyone's covered.
Yes, I have had clients, there's just lots of discussion. There are insurance brokers who will help you or who will get you signed up on the marketplace, right? But they
Yes. For fun.
usually, because they're brokers, right? It's like their job and you're paying them.
Yeah.
For you work for a nonprofit
So
organization.
we're doing this completely free, unbiased.
Yeah.
So I would say it's in your best interest to use a navigator over a broker.
Yeah. Okay. Well, great. Thanks so much, Sarah.
Of course.
And that wraps up our topic for this month. As a reminder, our expert interview, I'll go ahead and put the slide back up to remind everyone. If you want to join in, Lindy, our survivorship coordinator, will be hosting our discussion group, and we're happy to kind of help discuss this topic and connect you to whatever resources that you might need. We will be meeting via Zoom on Tuesday, September 26th. So you can register for that at cancerservicesonline.org/register. And yeah, be sure to stay updated with all of our survivor programs by checking out our website, cancerservicesonline.org. You can make sure you're on our email newsletter, follow our social media channels and our podcast, and let us know if you have suggested topics or any questions that we can help you with. That's all for today. Thanks so much. Have a great day, and we will see you all soon.